hapo St. Mary's Hospital, hospitali imefungwa, lakini mochari inafanya kazi.
Na mimi nataka niseme hile hospitali wamesema ya St. Mary's Mumias, faith-based organization, waliweka claims za SHA 117 billion Kenya shillings.
Mtu kumbe pia ameanza kuwa muongo. Yaani wewe unadanganya watu. Mimi nimekuwa huko kwa hospitali. Na nikakuwa huko kwa hospitali, hospitali imefungwa.
The gates of St. Mary's Hospital Mumias closed, not because it burnt down, but because a 117-year-old institution couldn't get paid by Social Health Authority. Staff were told to stay home after 4 unpaid months. 180 million Kenyan shillings in claims gone unpaid. And now the man under fire, Prime Cabinet Secretary Musalia Mudavadi, fires back.
Kwa hivyo kama wamefanya mismanagement katika hiyo hospitali, wasiletee taifa nzima. Let us be accountable. Mnataka serikali iwe accountable. Mnasema mnataka Ruto awe accountable. Mnataka Wetangula akuwe accountable.
Not the government, but hospital mismanagement. He said, stick around. Your health, your tax shillings, and your politics are all involved. A quick rewind. On October 1st, 2024, the Social Health Authority replaced the beleaguered NHIF, tasked with running public health insurance via 3 new funds. It was meant to be Kenya's answer to affordable modern healthcare. Fast forward to August 2025, the system is teetering. During a burial ceremony in Malava, Mudavadi didn't mince words. St. Mary's claimed 117 million Kenyan shillings. They have received only 82 million Kenyan shillings. He said the ministry has documents. He challenged politicians spreading malicious claims. Hospitals must prove accountability or carry their own cross, as he put it.
Hospitali hiyo imelipwa 82 million shillings out of the 117 million Kenya shillings. I have a record. I'm giving you these figures kwa sababu I know what they got. Na ukiweka claims ni lazima ziwe verified. So far they have received 82. And I am ready, if they want to argue, we are ready to produce evidence. How much they received in November last year, in December, everything. I have it even on my phone here. Naweza soma sahi. Kwa hivyo kama wamefanya mismanagement katika hiyo hospitali, wasiletee taifa nzima. Let us be accountable.
But let's not reduce these to numbers. 4 months without pay drove staff to down their tools. On July 1st, HR sent emails. Don't report until further notice. A century of service stopped, and families and patients suffer. Meanwhile, Social Health Authority owes St. Mary's 40 million Kenyan shillings and the old NHIF 140 million Kenyan shillings, 180 million Kenyan shillings in total. Here's the math stripped of spin. Claimed file 117 million Kenyan shillings. Received 82 million Kenyan shillings, according to Mudavadi. Outstanding SHA share 35 million Kenyan shillings, maybe even more. NHIF backlog 140 million Kenyan shillings. Total unpaid 180 million Kenyan shillings. Mudavadi insists Social Health Authority is paying, but the picture on the ground is bleak. However, Mumias East MP Peter Salasia would have none of it. He claims Mudavadi has become a humble liar, like how the government always lies.
Hospitali imefungwa kwa sababu hawajapata pesa. SHA imekataa, walifunga NHIF walikuwa na deni ya NHIF 143 million. SHA imeshindwa kulipa 40 million. So how can a hospital like that operate na at the last pesa ambayo hata mimi nimetoka confirm saa hii pesa ambayo wamepata ni only 1.2 million. Musalia Mudavadi unadanganya watu hapa. Kumbe wewe pia na unaongea na sauti ya upole, ni kama mtu ambaye hebu nisikie, alafu anasema pia ameanza kuzoea bilioni. Nyinyi mko na njama ya kuua mahospitali ambazo ziko na za faith based hospital. You want to kill them. That's why you are not interested to address their challenges. SHA is not giving out money to them in their claims that they are making. So you are saying 82 million out of 117. Alafu unaongea unasema uko na document. Na mimi mwenyewe niko na hata watu wa HR, watu wa administrator, kanisa yenyewe inaongea ile ambayo iko na facts. Musalia Mudavadi unadanganya. Nyinyi watu wewe yani wewe pia kwenda huko wewe Musalia wewe pia wewe.
Mudavadi frames these as internal mismanagement, cartel behavior, hidden evidence, lack of accountability. Yet, to be blunt, it's political convenient. Hospitals blame the government blames hospitals. Meanwhile, workers starve and the public loses faith. This closure should trigger real reform, not deflection. SHA must clear pending payments transparently, publish accountability reports for hospitals.
Ukiona St. Mary's Hospital imefungwa kwa sababu SHA haijalipa pesa na deni ya St. Mary's Hospital. Lakini ile kitu inanishangaza, hapo St. Mary's Hospital, hospitali imefungwa, lakini mortuary inafanya kazi.
Visitors are now greeted by closed gates and security guards at the deserted facility. However, the comprehensive care unit, which treats patients with HIV or AIDS, the renal unit and the mortuary remain open despite the hospital's closure. SHA is designed to provide healthcare services from empaneled and contracted healthcare providers and healthcare facilities on referral from primary health facilities. Here's the truth. Politics and healthcare are inseparable in Kenya. Kenyans fund these schemes. They deserve clarity.
And enforcement actions.
Taking to his X account, Duale posted, quote, "No amount of propaganda or blackmail will deter us from fixing our healthcare system. We know saboteurs of SHA have recruited several groups, including some sections of the media, to advance their agenda. Let them be warned. We are fixing this thing regardless of the noise. Our work has just begun. We will not rest until every Kenyan has access to quality, affordable and dignified healthcare free from the burden of fraud," unquote. Cyprian Nyakundi responded, "There is no way Aden Duale can solve the same theft he caused. On one hand, he says he's fighting SHA graft. On the other hand, he's attacking and maligning those asking questions. He is here and there. Duale must go. Arrest Duale. If accountability fixes the SHA, praise it. If failure follows, remember, and Kenyans demand better." What do you think? Newsroom, Maisha TV, Bushabi Jr.